Good afternoon, everyone, and welcome to the first European Hub co-chair. I'm Floriana Pinto. I'm a critical care nurse from Milan in Italy, and I'm one of the 4 co-chair of the European Hub of the Nursing Now Challenge campaign. So today with me, there will be Andrés de Juan. I hope the pronunciation is good, Andrés. So, hi.
Hi all. Well, as Floriana said, I am Andrés de Juan, a nursing student in the University of Barcelona in Spain, and I am actually, as Floriana, one of the 4 co-chairs of the European Regional Hub of the Nursing Now Challenge. And I'm very happy to be here with you all, and I'm sure that we are going to have an interesting webinar with all these speakers. For those that want to ask some questions during the webinar, we will have a space for that later on, so you can write them in the chat box or in the Q&A box, and we can discuss them after the webinar ends.
Okay, today we would like to talk about some important issues of the profession. So as you see from the title of the webinar, so nursing and midwifery in Europe, perspective and challenges, because we think that professional identity is an important issue for profession, because even if we come from different background in Europe, we share the same vision of the profession. So today, after talking about the situation of nurses and midwives in Europe, we will see some good example of leadership, and we'll talk about them. So let's start with the session. So it's my pleasure to invite Walter De Caro, who is the president of the Italian NNA Association, to talk about the first session. So the situation of nursing and midwifery in Europe today. Thank you, Walter.
Thank you for this opportunity to share. Thank you to Floriana, Andrés, and all the Nursing Now Challenge team of Europe. I think that also Paul de Raeve after can add something about nursing and midwifery situation in Europe. I think I am not the best speaker for this, but I work for Italian Nursing Association and also a member of a European Forum of Nursing and Midwifery Association, that is EFNA. The outline of my presentation is connected to the data of nursing and midwifery challenges and some implication. About Europe, we have 2 different Europe: European Union, that is 27 countries, and WHO European region, that is more than 1 billion of people and 53 countries. There are, as you know, different health situation, different trend, different environment, and also there are some countries that are affected from health, social, and political crisis. There is a common trend that is the fever for digital transformation and use of health data. About our role as nursing and midwife, we have to work for citizens, and this European pillar say that citizens expect access to care, citizens expect to be protected by nurses and midwives, citizens expect to live in healthy communities. And this is connected to the evolution of health service worldwide and in European Union that pass from broke-fix system, a reactive system, to a different system outside of hospital with new possibility connected to the prediction, artificial intelligence, digitalization. That is an evolution of concept of health, an evolution of work of nurses. About health system and nurse in Europe, health service accounting for more than 50% of expenditure in Europe, and healthcare workers are about 10% of workers. In European WHO European region, we are more than 7 million nurses, and we represent 70% of health and care workforce in WHO European region. Based on the last data, there are more or less, the average data is that we have 80 nurses for 10,000 people and 4 midwives for 10,000 people. But there are a really difference in nurse density. For example, in my country, Italy, we have more or less 6 nurses for 10,000 people. In Finland, there are double number, or in Norway, there are more than double nurses respect Italy. There are a real difference in density of nurses. The same is for midwife. There is one common data in the Southern Europe and in the East part of Europe, there are less nurses and less midwife respect Northern and Western Europe. In this picture, it is clear that, for example, in Finland, there are more or less 300 healthcare professions for 10,000 people, and for example, in Italy, there are about we are more or less 1,050, less than half. The same is for doctor-nurses ratio. There are a really difference from country to country. For example, in Italy and in Spain, there are more or less 1 nurses and 1 doctors. In Finland or in France or in Belgium, there are 3 nurses and 1 doctors. Other crucial issues is connected to the age of nurses, age of over 55. And also in this situation, there are a number of countries that are more and more nurses that are all nurses. And we have to work for new generation of nurses. And I know that Nursing Now Challenge work a lot about it. Some challenge, common challenge. Fair pay. We have necessity of different remuneration for nurses in Europe. Is a common issue in a number of countries. For example, in these days, in the last December, there is a real strike in UK, and also there are a number of strikes in a different countries from Finland to Italy at different level. We have necessity that nurses have be paid at degree level at same level of other degree level educated profession. About shortage of nurses, our Catalan Paul de Raeve, Heinz Kluge work a lot, stress that all the country have to work for reduce the shortage of nurses. In UK, there are more or less 50,000 less nurses, 50,000 vacancy. In Italy, we have 1,000 nurses vacancy, and there is a real issues for us. For example, another issue in Europe is connected to the mobility and ethical recruitment. For example, in Switzerland, there are a new open hunt for Italian nurses. Why? In Switzerland, a nurse earns about 5,000 euro. A nurse in Italy earns about 1,500 euro, and that is a huge difference. Other things is connected to the regulation and scope of practice. EFN, European Federation of Nurses, work a lot for have a directive, a framework, and European legislation at the registered nurse level, for have one level of nurse that can move country to country, one level of nurse university educated. But now we have to work for have a common framework for healthcare assistant, a common framework for specialistic practice for nursing and midwifery, a common framework for advanced practice. During COVID-19, we have necessity of, for example, of intensive care nurses, specialist in intensive care nurse that can move country two countries, but we don't have a common framework in Europe now. About education, we have a crucial issue connected to the attractiveness of nurses. Why? Because nurses earn the fair pay of nursing is an issue. In Italy, this year, we have 20% less of candidates to the university place. And this is a problem. Other issue is connected to the retain and recruit educators, and also adapt curricula to new challenges like digitalization, like elderly, and so on. Challenges about leadership. WHO region, EFN, work a lot for establish government chief nursing officer position. About all country establish this position, but this position have no power. In a number of countries, there is only a name, but there are only advocacy consultant, is not power at government level. And we have to work for this. We have also worked for clinical leadership and medical dominance. We have to work for establish something different in terms of relation with medical doctors in a number of countries, starting from Italy. And other issue is connected to the role of regulators because not all countries have the same model of regulation. Some countries have government level, some countries have regulators with some power connected to the education on revalidation. There are issues also connected to the accreditation and certification of competencies. Issue and challenges connected to us, to nurses and midwifery. Mental health is a crucial issue. WHO established a pan-European mental health coalition for help and for build some initiative for this. 1 to 10 nurses reported suicidal intention from the start of pandemic. In Italy, we have during pandemic 7 nurses that committed suicide. And in this moment, with nursing shortage, with the violence and so on, that there is necessity to work on mental health. About the violence is another issue. About all nurses during the life, during the career, have some episodes of violence, aggression, and so on. In my country, that we have a long line at the emergency department. In these days, we have a number of different violence issues respect to doctors and nurses, and it's a real issue. This other crucial challenges is connected to the health equity, respect different population, the high cost of healthcare, and the government economical problem, and the promise and the pitfalls of digitalization and technology. There are a number of initiatives and recommendations, starting from Nursing Now challenges. And we have different organizations, as I said before, a WHO organization at European level that establish chief nursing and midwifery officer group. We have an organization that is linked with European countries at WHO region level, like EFMA, and we have at the European Union level, and also at the Council of Europe level, EFN, European Federation of Nurses, and European Association of Midwives. There are a number of other specialistic organizations like ENSA, FONEU, and so on. but the biggest lobby organization at European level is represented by Paul de Raeve that speak in this webinar. I think that is the real organization that work a lot for build a common framework for nurses. And there are the other organizations that EFMA that build together nursing and midwifery and work also for the Russian country. And that is complicated work also in terms of different language, different aspect work for all this country, because European region is very different. There are a number of European Union initiatives like Next Generation EU that have established more than 750 billion of euro for stimulate economy, and about 20% is connected to the health and social care. And also European Union established European care strategy for career and care receivers that is connected especially for the elderly and for the children. And I think it is useful having a common co-creation in terms of institution and association that I nominated before. At WHO Europe region, there are a roadmap for guide the implementation of global strategic direction on nursing and midwifery that have 4 areas that are jobs, education, service delivery, and leadership. These 4 areas try to establish a common ground for leadership or for service delivery or for establish, for example, new attractiveness for nurses. These objectives have to have some indicators, have a number of things that at government level, at country level have to do, and every one of us have to work for stimulate government to work on this direction. I stay at the end of my presentation. Nurses have to lead the transformation. We have to learn, we have a number of lessons learned from pandemic and in terms of new direction of emergency situation. We have to work at economical and socio-political level for change the health system. We have to work a lot at strategic level for digital transformation and on the data of patients and nurses. And we have to work for improve the interface from people, health service, and professional. We have to work on human resources. The citizen and the professional are crucial for change our society. And WHO European region at last regional committee in September in Israel made a 10-point plan that you can read here, and after I leave in the documentation that point all the situation that I speak before, and I think it is useful work on these 10 action for the future. For example, starting from education, respect the population need and health service requirement. Thank you a lot for this opportunity to share. Thank you to Floriana and the other colleague of Nursing Now Challenge.
Thank you, Walter, for your interesting presentation. You were brilliant to present us a real panorama in which we are working now, and we are now, in which we, as you said, we must start to work for next generation, because nurses and midwife, as we hear all around, are the key drivers for change. So thank you a lot.
Okay, so thank you so much, Dr. De Caro, for your speech. It has been very, very interesting to see all the differences that are in between the European countries regarding the payments, regarding the education programs, etc. I'm sure that some will have some questions later on, but now I am going to present Matthew Stewart, who is a practice development nurse and peer support warden at Gloucestershire Hospitals. He will talk us about rotation in nursing through peer support. So please, Matthew, the floor is yours. Many thanks.
And thank you very much for inviting the team to obviously present. So as it's said, my name is Matthew. I'm a practice development nurse and a peer support guardian for Gloucestershire Hospital's NHS Foundation Trust. And we created a peer support network called GlouStars. So as you can see there, it says it stands for Gloucestershire Hospital's Staff Transition and Retention Support Network, which is why we shortened it to GlouStars, because it's a bit long to say all the time. So this is to talk about retention in nursing through peer support. If I can. So obviously you can see myself on there. I also have my two colleagues, Charlotte and Leonora. So we are the three peer support team guardians that are obviously employed by our or through our organisation. So it all began back in 2018. Charlotte, who is pictured there on the left-hand side in that picture, along with her early career colleague, Sophie, both were on the preceptorship programme within our organisation and came up with this idea of a network to support newly qualified nurses who were undertaking a preceptorship programme to have that support with each other and for each other going forward. They did a QI project after finishing preceptorship to embed this network within the organisation. So that was back in 2019, just prior to the pandemic. And obviously during the pandemic, everything was moved online, so it was run a little bit differently. And then that's how I came involved as well, from being through preceptorship and having the support from them. And then going through that and then through the pandemic, we've obviously been giving that support out to our new colleagues who are on preceptorship programs, and obviously with our international colleagues as well, who come from all over the world, offering them that peer support from people who have just been through their preceptorship program to help with the preceptorship program and beyond. So as you can see, we have a team of what we call peer support guardians, and the whole point of that is to offer check-ins to colleagues both at work. So we do a lot of ward walking and seeing these people actually physically out in practice, and that came from obviously discussions and shared decision making with our colleagues out in practice that they wanted to see us out in practice with them. So we go out and as part of our delivery at the moment, we are seeing everybody on the nursing preceptorships at least once out in practice. And that obviously then also leads to further check-ins as well going forward, which some people ask for, or we establish that they need that as well at the time. We obviously also see them on the preceptorship as well as peer support, and we also have a whole range of volunteer guardians, we call them, who are actually out in practice and visible on the wards and departments to see, so people can see them and obviously have that visible presence as well. The whole point of it is obviously to make staff feel valued. Obviously in the climate we are at the moment, that's what people just generally want, is to have conversations and being able to reflect as well, which is something we facilitate. So we do have a shared decision-making council. As you can see on this picture, we have a range of individuals, and it's not just from nursing. We do also cover allied health professionals, midwifery as well, and we open up this shared decision-making council, or peer support council as we call it, to obviously talk as in general from colleagues across the organisation about what's going on and what the issues are facing people. We get our guardians actively involved, and most of the people you can see there are our guardians in some respects, but we also have our early career guardians who have specifically just done preceptorship, and they are the best people to obviously help those people which are going through preceptorship because they've just been through it themselves. Now this slide does look a bit crazy, but this is just to obviously show the data we've collected over a 6-month period from May to October of last year. these numbers have obviously increased since then, but it just shows you the range of stuff which we obviously cover whilst having these conversations with people, of wellbeing conversations, reflective discussions with people actually physically out in practice. But again, as it was alluded to in the presentation, we obviously have a lot of things around career conversations, and that people are looking at transferring or leaving, not just the organisation, but the health service in general. And our whole thing is that we want to have those meaningful conversations with people to find out what they want. And it might just be that area of work, it isn't for them, that ward area or that environment. So we have very close links to some of our senior leaders within the organisation to help our colleagues to move different areas. And it could just be that they just want a bit of a change of pace, sort of like a bit of an itchy feet sort of thing that they want to move on and develop as well. And also we do provide some sort of education and CPD as well to our colleagues whilst we're out there. And over that period of time as well, we obviously have seen the preceptorship groups 9 times, different groups of them, because obviously they have to have smaller groups now, which also equates to, as you can see, 210 people that we physically see on preceptorship programs. And we are constantly inducting more guardians as well. So that's sort of what we do here in terms of peer support and how that helps with our retention of having those conversations with people actually out in practice and in the workplace as well. Our contact details, our email address and our Twitter is obviously on there. Should anybody want to contact us, we're more than willing to talk about what we do and perhaps show you a bit more about what we do as well. But thank you very much.
Well, many thanks, Matthew, for your talk. It has been very interesting, and it's amazing how the work that you are doing enables the staff, the newly qualified nurses, to feel supported and to feel that they have a possibility of growth in the organization. So that's very important for newly qualified nurses, I think, as I am a nursing student, so it's something very valuable for us. That has been a very good example of rotation, and I think that's one of the problems that we are facing nowadays, the retention in the hospitals, in the healthcare centers, but as well in the universities, in the schools. So it's very important to have some this kind of leadership initiative that you and others are doing. So it has been very, very valuable to hear that. So now I am going to present Dr. Sonia Sevilla. Dr. Sonia Sevilla, she's from Barcelona, and she's a postdoctoral researcher and a health technician at the Catalan Health Service. And she will talk about the situation of the advanced practice nursing in Spain. So many thanks, Sonia. Go ahead.
Hi, everyone. Let me share my screen with you. Here you go. First, thanks to all the coaches and the European region of the Nursing Now Challengers Committee for inviting me and for letting me share with you the IPACAT project. My name is Sonia Sevilla. I'm a nurse, and I'm currently working as a health technician for the Catalan Health Service, which is the commissioning board for the health in Catalonia, in Spain. During this presentation, I will explain the IPACAT project, which is the name for the APN project here in Catalonia. The main results that we have obtained during the last 3-4 years, and the current state of the APN development in our context. The IPACAT project was born from the leadership of the university, the Autonomous University of Barcelona. They wanted to promote APN's role. APNs are not a role that is recognized in Spain, and we don't have a regulation, but the team shares the international vision and support for these professionals to help ensure sustainability and improve the current fragility of our health system. I have also the opportunity to work as a CNS for 10 years in the UK. Specifically, I work as a MS nurse, and I was able to see and to have the opportunity to see how the role I played greatly benefited the patients I care for. So as a research team, over the last 3-4 years, we have been considering several studies to be able to analyze the scope of advanced practice, the opinion of health managers and the multidisciplinary team that works with them, and more recently to work for a consensus on the key aspects that an APN model should have.
Sorry, Sonia, we are not seeing your slide because they are not in presentation mode. We see only the first slide.
Oh, really?
Yeah.
Let me stop and share again.
Okay, perfect.
Yes, you see?
We are results of the study, yes.
Right, great, okay. So you probably missed the names of the team, but I can share with you the presentation and you can distribute it if you want. So in the first study, we consider ourselves, okay, let's start at the beginning. No? As I mentioned, APNs are not regulated in our context by the government, but they exist. And we have institutions, we have implemented the role, and currently they're recruiting as an APNs. So we plan to identify APNs. Where are they? What kind of practice they doing? What kind of the scope of practice and they having, what types of institutions, service or area they have been developed. For this, we use the APN delineation tool, which is a valid and reliable instrument that is able to show practice patterns. The instrument is referenced in the latest guidelines, APN's guidelines from the International Council of Nursing, and states that the instrument could demonstrate the ability to clearly delineate and define APNs. You have the results of this study published in the International Nursing Review, but just very briefly, from the 1,200 participants, nurses participants, which answered the questionnaire, 269 of them nurses complied criteria, both for formative and the scale to be an APN, and 90 of them met the criteria as well in the results of the scale, but did not have the training of master's degree, which could be explained by the history of we have of the profession in Spain, which we haven't been able to study a master's degree or PhD level only for the last 10 years. The three most common job designations among the APNs here were case manager, clinical nurse, advanced practice nurse, but they were many more, and this is because there is no clear guidelines for the designation. We also observed that one of 3 nurses that participated, which were specialist nurses that trained as a specialist nurses, they didn't meet the criteria to be an APN. Just to give you an overview of some of the areas of experience that some of these nurses have, were related mainly and with a very common sense, we're related to aging, chronic conditions, end of life. They were also related to mental health, primary care, and also the processes like internal medicine or oncology, diabetes or A&E. The number of APNs that we identify as they met the criteria of the international criteria to be an APN per 100,000 inhabitants were 3.5. So this ratio were very similar to the level of other countries where the role of APNs have been recognized. In the second study, we asked ourselves, okay, we now know where we have APNs, and we know where they are, we know which one is the profile. But what is actually the opinion of the health professionals and the managers that are working with them, are trying to develop these roles? So for this study, we conducted interviews and developed an opinion scale. An opinion scale that was about role activities, development and teamwork, leadership, efficiency, support, recognition, the organizational model that they have, and what they thought about the regulation of these nurses. We have 584 replies, and mainly they responded like doctors and nurses at different levels. For this study, we have, it's in process of being published. Just as as an overview, we have many affirmations about APNs. For example, this one that I put in this slide, that the fact that some APNs perform and interpret diagnostic tests that are usually doing by other professionals leads to greater efficiency. So by this the sentences, we was able to analyze what they thought was the expectations, not only between professionals, but between categories within the institution. This study shows the opinions, but also the expectations that the other professionals had about APNs. And hopefully we'll have the results published very soon. Some of the key, the main results, like they said, the APNs are reference and advising other health professionals. They should be accredited. They are effective and efficient resource to the institution. They support and pass knowledge, expert knowledge to other team members. They advise, they can lead not only multidisciplinary teams, but also other health services, and they lead in the provision of health services. The ignorance of the potential of this role is a barrier for the implementation, and they should be, it's a priority that this role should be regulated, very well designed to clarify their role. And finally, on the last study, we thought, like, okay, we know now where we have these nurses. We know what the colleagues and the managers think, but why we don't try to make a discussions about the key aspects that an APN model should have. So for that, we thought we need to do that with the scientific nursing associations, because they're the experts and they're the ones that should be leading professional development in the areas. And we identify some key aspects in the literature, that they should be, a model should be having. And we did that in two phases. First, we did one-to-one interviews with some of the main representatives of the nursing associations. And then we did two rounds Delphi study to arrive to a consensus of what this model should look like. These are the key aspects that we agree. Like within brackets, you can see the levels, the percentage of agreement, the level of agreement that we arrive with these associations, the professional associations, in definition of role, scope of practice, domains, autonomy and responsibility, skills, education and training, and what should be the regulation, the governance of the organization. We thought nurses have the duty to regulate themselves. So let's see, like what we arrive and what consensus we have. And we actually had a great level of agreement between all of them. It was only when we went down to really specific key aspects, that it was some that we had a lowest level of agreement. For example, in autonomy, we had a level of agreement of like 90–100% of like APN should be prescribing, delegating. Sorry, is duplicated the sentence. But it was some of the other affirmations, like for example, one of the criteria with a low level of consensus was that APNs could establish primary and clinical diagnosis, and this is only had a 63.6 agreement, but some of them, they didn't reply, they didn't answer that question. So they reply as indifferent. In this case, some of the comments were made in the sense that the type of diagnosis should be specified, or the corresponding competencies and consensus with other disciplines should be defined. And regarding admissions and discharges, it was also a low level of agreement, and it was commented that it should be established what type of patients and what reasons of admissions of APNs can assume. Other observations were related to master's education. This is a criteria that is defined by the International Council of Nurses. The APNs should be educated at master level, but it was some of the low level of agreement was around the access and the content of these masters. If the master's degree should require a minimum of years of professional experience to gain access. Currently in Spain, all the nurses can access any masters independently of the time or experience that they have. So here it wasn't, we didn't, I mean, it was a 68%. It wasn't even below 50%, but it was lower than the other key aspects. Other aspects also with a low degree of agreement, it was the criteria related to the importance of the subjects, like for example, physiopathology or advanced pharmacology, they then 68 or 72% respectively. So as a conclusions, currently, well, this is the first studies of these characteristics in Spain, and currently the health profession regulation law in Spain is the one that regulates the practice at the level of functions and the competencies that the nursing profession, and it doesn't contemplate advanced practice, which we know is being carried out without formal regulation. With these results, we have approximated the consensus of the profession and the collaborative effort with the scientific associations. We won't agree in the key aspects for the APN model, and this should allow a successful implementation and integration of these roles. The importance of having an APN model, even for the whole Europe, because it's important for us that these values are international, so we can have mobility between the nurses. And this is critical on the shaping of the foundation of a solid regulation, you know, that protects us as a nurses, but also the population in general. And just to finish, we have some recommendations after these studies. We think a model of APN contributes to accommodate new and innovative forms of care that we currently needed, like Walter said, all the lack of nurses, all the challenges that we currently facing. And I think the development and implementation of an strategy focus on the deployment of these nurses could help with some of these challenges, and also to promote an implementation and organizational level. And this is all for me. This is my contact details, and don't hesitate to drop me an email if you have any questions.
Well, many thanks, Dr. Sonia Sevilla, for your speech. It has been very, very interesting for all of us. It's very important what you are doing, because with this project, you are opening new horizons to the Spanish nursing, and you're going to be kind of a reference for the new generations. And if it's possible in the future to implement advanced practice nursing, as you were talking, or in other countries, in Spain or in other countries, you're helping to the new nurses to work to their maximum scope of practice, and that's going to help the new generations to have more opportunities to serve the communities where they work with. It's very valuable what you are doing, and it's something that we really appreciate in the Nursing Challenge, to have this kind of leadership examples with us. So many thanks for your talk.
Thank you.
Yes, thank you, Sonia, for remembering us the importance of having a regulational framework of APN, which is a very, very important issues now and challenges for the future. So in which nurses and midwives can express themselves, their potential and their profession, so in healthcare services. So really thank you for your good example of leadership in research. So now I would like to introduce another one of the co-chair of the European Hub, Malgorzata Stefaniak, who is a midwife in the Medical University of Warsaw, who now will talk us about the mentorship, another good example of leadership, a project in a hospital. So thank you, Malgorzata.
Okay, dear fellow participants, my name is Malgorzata Stefaniak. I come from Poland. I am a midwife. I work at Medical University of Warsaw, where I teach midwifery students. I conduct research about a special educational system. I am a coordinator of mentoring program in my institution. And today I would like to share you my knowledge and experience about mentoring in midwifery. Mentoring in the nursing and midwifery profession is a topic of utmost importance, because all over the world mentoring programs are an integral part of our group professional development. Mentoring is defined as a relationship between an experienced professional and a less experienced beginner in a field. The mentor gives support and advice and helps in choosing aims and perfectly the practical abilities of the mentee. The mentor role is also crucial in providing a safe and friendly learning environment, as well as introducing the reality of professional work. The relationship is useful for both mentor and mentee. Today, the variety of mentoring program is very, very large. I'm sorry, could you share another slide? Thank you very much. These programs are tailored to the needs and expectation of the participants. The first mentoring program were initiated by the Canadian Nurse Association, followed by those implemented by International Council of Nurses. Recognizing the important role of this strategy, 2 years ago, ICM published a guide how to set up mentoring programs, what it means to be a mentor, how to prepare for this role, and what a proper mentoring process should look like. Next slide, please. The result of mentoring programs for nurses are evaluated from the point of view of the benefits or individual and entire organization. At the individual level, they can improve job satisfaction, reduce stress, increase self-confidence and competences, and reduce quit rates. This is important. Research has also proven that mentors are less susceptible to burnout, engaging in experience. They enhance their self-esteem, which is associated with increased job satisfaction and less quitting, both by experienced nurse and novice. Research also showed that mentoring helps with more purposeful career development and increased scholarly activity among nurses engaged in research and teaching activities. Mentoring can also contribute to raising the status and prestige of the nursing profession, and they both can be made better by feeling a professional identity. Next slide, please. And when we look at this aspect, we decide to make a new educational project for nurse and midwifery students, because we believe that this change should start as early as possible in the training on future nurse and midwives. And in my institution, we run a mentoring program for midwives and midwifery students. And in the years 2015-2018, my institution, with cooperation with another 4 universities, carried out the implementation and evaluation of dedicated education unit in Europe, international project as a part of the Erasmus Plus program. Next slide, please. The result of this cooperation was the development on an innovative model of clinical education, the implementation of which promised the implementation of modern methods of teaching practical skills to improve the quality of professional practice for nurse and midwifery students. In this model, model forms of education as used, such of course as coaching and mentoring. In the EU concept, practical activities for students are implemented in mentoring system, and mentoring is an effective alternative to traditional teaching, which currently has a group-based character and mainly led by academic teacher. The innovation of the developed model consists of the organization of individual practical classes for midwifery students, which are conducted under the supervision of midwives, trained clinical mentors from the hospital with the support of the academic teacher and the head midwife. In this conception, the university is responsible for supporting clinicians in this particular role, linking the academic community with healthcare institution. And next slide, please. Now, I don't have any more time to present detailed information of this subject, but I would like to encourage you to read my articles about mentoring program, which we organize in my institution. Thank you very much.
Thank you, Malgorzata, for giving us another good example to manage some key issues of the profession. So mentorship and supporting, as also explained our colleague Matthew, are really, really important for retention for the profession nowadays. So Andrés, if you would like to continue.
Thank you so much, Malgorzata, for your talk. Now we are going to listen to Alice Thomson, who is a senior research nurse in the National Health System from Scotland, and she's part as well of the European Challengers Committee, and she will talk us about the work that the European Research Group is currently developing. So please, Alice.
Hi everyone, as Andrea said, my name is Alice. I am a senior research nurse working in NHS Scotland. And I'm also part of the Nursing Now Challengers Committee European Hub, and we are working on a current research project. So we decided to put together that we wanted to do a research project quite early on when the Challengers Committee was set up. And this is sort of I'm just going to go through what it is that we're doing and sort of where we're at with this. So if we can go into the next slide, you'll see we are currently using the working title, The Perceptions and Identity of Modern Nursing and Midwifery in Europe. So this came about from our mission statement, which you'll see parts of in the next slide. Which you'll see that we put together as a group, and we sent this out to the board. And as you can see, and as Floriana mentioned earlier, we have quite a we've got quite an influence on what we would like to look at, and quite an emphasis on the identity of nursing and midwifery in Europe. And as you can see from the excerpts, that how this is unique to the profession, so therefore this was something we wanted to develop. And if we can go on to the next slide, you'll see that we set out 4 aims for the research from this that we would like to do. And these are to understand how nurses and midwives' perception of their own professional identity around Europe and highlight any differences between the countries, to understand what impacts the perception and identity of nurses and midwives, to look at the differences within nursing and midwifery roles in Europe, and to help identify what could be done to improve nurses and midwives' self-perception and identity within Europe. So these were 4 things that as a group we put together as what we wanted to aim to do through our piece of research. So if you go on to the next slide, you'll see what it is that we're planning on doing. So what it is that we're actually doing is we're putting together a mixed methods questionnaire, which will be roughly around 20 questions. It should take about 15 minutes to complete, so it shouldn't be too much of your time. And from this, we're hoping to collect quantitative data through close-ended questions. We're looking at things like what country you're in, we're looking at some Likert scale questions, what area of practice you work in, but then also we're looking to collect some qualitative data through open-ended questions using free text answers where you'll be able to give your own opinions and elaborate on some of the answers in your area and how your personal identity and professional self-perception. So this is quite a very brief overview of what we're doing. So there is a group of us working on this, and we're working with the Nursing Now team and some of their colleagues at the University of Coventry, just to make sure we've covered all our bases and have all the ethical approvals required. So the next steps are we aim for the questionnaire to be circulated soon, hoping this should be via email and social media. We do have our own Twitter account, which is the European NNCC. And also we would ask you if you could help us with this and share it on your own social media platforms, and also inform any colleagues. So we're looking to collect data from any nurses or midwives that work within Europe. They don't have to be part of the Nursing Now challenge. So we are looking for your help with your connections to send this on. And next slide. And so just one thing is thank you for everyone for showing up today, and thank you from our research team. As you can see, we've got a good team working with us, and we hope that we'll get some good data out of this piece of research that we're doing. So please keep an eye out for it, and hopefully it'll be with you soon.
So yes, thank you, Ellie. So let's all be prepared to receive next news and to participate to this research very, very soon. And I hope everyone will collaborate and will share this research, which is very important for us. So the last but not the least, so I'm very grateful and honored to give the floor to Paul de Raeve, from the Secretary General of EFN, that will give us some perspective and reflection from EFN for the future about the profession. So thank you, Paul.
Thank you very much, Floriana and Andrés, to invite me to this webinar of Nursing Now. I hope you can see my few slides. Do you?
Yes.
Yes. And so I can say, adding on what Walter's important presentation brought to the table, I can add that EFN, European Federation of Nurses Associations, was developed in 1971, when the European Commission drafted the legislation of who is a nurse and who is not a nurse, who is a physician and who is not a physician, who is a midwife and who is not a midwife. So that legislation was important for free movement of the healthcare professions within the European Union. So that means that EFN is currently covering 36 countries, of which, of course, the 27 European Union countries, and some more for those countries who are already in the process of negotiating EU accession or who have already a legal link with the European Commission, like Norway, like Sweden. And so my role, dear colleagues, is to see in this picture, you see the European Parliament, the picture below, in the middle, on top left, you see the European Commission. That is the institution who writes European law. And of course, on top above is the Council of Ministers for the European Union. These three institutions are the basic for formulating the European legislation, which impacts on national legislation. And when I go to the European Commission or to the European Parliament, I go there on behalf of EFN members who in total represent 3 million nurses. And I was very attracted, Floriana and Andrés, by the title of this webinar, Professional Identity. And for EFN, it is important to look at this professional identity, but from an EU legislation perspective. Who are we? And how are we protected by European law? And that is why the European EFN has developed this workforce matrix, which is called the EFN Workforce Matrix 3+1. And it says we have the general care nurse, the Directive 55 nurse, with a specific Annex 5, which regulates the bachelor nurses. You have to understand that there are governments in the European Union who wants to downgrade the nursing education, make nurses cheaper. And that is a huge danger because we have this directive. And if a government is planning to damage the nursing education, the European Commission will bring that country to the European Court of Justice. So this is protecting us. This is protecting our identity. Our professional identity is protected by EU law. And that's the only thing up till now that is protected. We have also in the matrix the specialist nurses, and very important also in the matrix 3+1 is the healthcare assistants, where you have different developments. But in this webinar, and Walter made reference to it, but also Sonia made an important reference to this on the work in Spain, is the advanced practice nurse. I want to focus a little bit on this identity for a while. I have only a few slides to go. So first of all, this slide is important. The Directive 2013-55 EU regulates the bachelor nurses. So each country needs to make sure that the bachelor nurse complies with these criteria. Otherwise, you cannot call you a European nurse. But that means also that you cannot be called an APN because you cannot comply with the Directive 55. It is the starting basis for developments of professional identities. Now, EFN and its members, through the working group that we have established, we have made an analysis of who has APN in the European Union. And we came to the conclusion that almost half of them have established APNs in their countries. And there are also countries who have not. You see the APN established in your country, the yes and the no's. Now, this is a graph from WHO on the roles, and you see where is Europe in this development. Look at Africa, look at Americas, look at the Eastern Mediterranean. So Europe, according to the data of Europe, of WHO Europe, the region, 54 member states, only 30% covers APN. Now, from a European Commission, a European Union perspective, this is different. And from the countries who said that they have APNs, only 11 have established the minimum requirements. So the message here on developing this professional identity, there is still a long way to go. And when it comes to the education around it, you also see that the different countries have different modules. You have one country where there is 60 ECTS spent on becoming an APN, but most of the countries have 120 ECTS, and 1 or 2 countries have 160 ECTS. So there is no Commission, European Union guidance yet on developing this new identity, which is so important post-COVID-19. And I'm going to close down my presentation, Andrés and Floriana, by saying the definition, the sense-making, the operationalization of advanced practice vary across Europe. And therefore, Sonia, your work in Spain and many other member states is crucial to bring that all together and to see how do we want the European Commission, the European Parliament, to start regulating for the European Union, like the bachelor nurses, the scope of practice in the European Union. So we are currently facing variations, that is clear. We need in EFN, and that will come up in the coming months in the April GA, we need a work plan so that the national nursing associations can guide us through the development to taking away these variations within the European Union. So in that sense, this is only a very small part of identity discussions, but an important part, especially with the healthcare systems in many countries collapsing now. Many countries, the healthcare system is collapsing, and the shortage of nurses is huge in all the member states. So we face, as Walter said, major challenges in the future. And perhaps this EFN workforce matrix 3+1 can guide us through European legislation, because that is the main goal of my work in Brussels towards the 3 institutions. Floriana and Andrés, thank you so much. I hand over back to you.
So really, thank you, Paul, for your work for regulation and recognition of the profession. So it's an honor for us to have listened to you. And we're looking forward to see next change. As you said, we are all prepared, unless we are not prepared. So we have to work all together, network, to get prepared for the future for these challenges, difficult challenges, but we have to manage and do it for the profession and for patients and people and healthcare service. So really thank you everyone for being with us. So we have a little space for question. So we start from the first question we have in the Q&A box for Matthew. So Matthew, the question is, how did you manage the COVID-19 pandemic challenges as a peer supporting team?
So thank you for your question. A very good one, actually. So as a team, we've only been employed into these positions for about the last 9 months. So before that, we were doing it all as voluntary roles in our volunteer capacities. So myself, during the pandemic, I was still clinically working on acute wards. So it was more of, at that point, just talking to colleagues physically when I was around in practice and out on the wards and departments, which I obviously got redeployed into as well. But also the fact of with the preceptorship groups that still obviously did go ahead during the pandemic, but very differently via Zoom and Teams, which was interesting. My first experience of obviously using virtual technology to present with. So we obviously had the check-ins with that. And again, we'd obviously given our preceptorship colleagues who were in those groups our generic email address, so they could obviously contact us via email, and then we would obviously try and ring them if they wanted that, or try and visit them. But obviously during that time it was hard, but again, obviously also having the Twitter, I think it was all looking at how else we could obviously see those people when we couldn't physically go and see them, so it was more virtually.
Thank you, Matthew. So are there other questions?
Well, yeah, we have some questions to Dr. Walter de Caro. So here you go. So Dr. Walter de Caro, you have talked about the regulations and some different issues around Europe. And there's a question that says, from which organization or organism should a common regulation come? From the European Union, from the ICN, etc.?
I think, and I think that Paul agree with me, that the solution is inside the institution. But we have necessity of great organization like European Federation of Nurses and also International Council of Nurses, and also Nursing Now Challenge and National Nursing Organization and University that fight, that work, that lobbying for this change. I think that the direction that Paul give us and the EFN give us with the matrix, EFN matrix with 3 levels of nurses is direction, and we have we hope that we have to help Paul to fight and change the directive, and with recognition of specialistic education and advanced practical education. But is a really fight, because in my country, and I think also in other country, there is a changing movement from medical dominance to other professional, and we have to work for improve the culture, the identity, that is the topic of today, the identity of nursing at different level. This is a cultural problem, I think. Thank you.
Okay, many thanks for your clarification. Floriana, we have more questions, I think.
Yes, we have a question for Malgorzata about mentorship. So from nursing perspective, so someone asked you, what do you suggest for starting a mentorship project in nursing?
Thank you for your question. I think that the success of mentoring process depends on adequate preparation, because we know that we should prepare up this project. And for my project involved a 3-phase work period. In a first stage and first phase, we create the mentoring program. And next, we selection a coordinator. This is a person who is as responsibility for implementation of this program in our institution. Next, cooperation with the medical staff and midwifery students. And next, preparation of information materials about mentoring project for the participants, and preparation of the training for mentors, because this is also a very important issue. And stage 2 involve a cooperation with midwife, providing practical training for midwifery students, organize training for midwives, future mentors, recruiting students for the mentoring program, and selection of mentoring pairs. And last phase is organization, practical classes in a healthy institution. Next, evaluation. This is also very important. Evaluation, this implementation of mentoring program. For my project, I publish a special guidelines. This, of course, this is. I'm sorry. I try to show you. This is my book, which is a guidelines for future mentors and midwifery students. How look like the mentoring process should look like, and how we can start realize in a mentoring program in our institution.
Okay, thank you. So Andrés, I think there is another question for Sonia.
Yeah, so Sonia, there's a question that says, do you think APN is something well known and root among students and nurses? Do you think that if a change needs to happen, the new generations are aware of this need? Perhaps you can talk between the difference in the UK.
I don't think it's a role that within the Spanish context is promoted or is well known within the students, because there is also no regulation and is also no framework, and all this has to be built. So they actually been developing on workplaces where they actually need it, because it's been finance or grant that, or some members of the team have been working abroad and they have seen the value of the role. So they just sporadically develop, but there is no clear guidelines, and this is like the confusion of the role, and is what is preventing actually the implementation. If you don't have a well-defined job position with a well-defined objective and functions of the role, it's very difficult to draw the lines. I don't think, I think it has to be introduced from the education and being able for students and for nurses that want to develop their career in clinical practice, that they don't want to become supervisors or like planning, like they just want to be next to the patients. They can grow their professional career doing direct care with them. But yeah, I don't think it's well known, and it's much more to be done in this in that area.
Thank you, Sonia. We have last question before closing to Paul. So as at the beginning, we have to, from Walter, we have to work for next generation. So the question coming from people see how we can do it, how we can work now from next generation, how can everyone, from where everyone can start in his or her little context.
Yeah, I think next generation and the European Recovery and Resilience Funds are quite important post-COVID-19. Billions are available, billions are going to the member states. Now they should spend it on investing in health. That's the first thing. It's not always the case. Now, if you see that the directive on mutual recognition of professional qualifications was developed in 1971. That is more than 50 years ago. It took us 50 years to protect the identity of a bachelor nurse. Now, currently, we have 11 member states who have national legislation. Developing national legislation on APN is not easy. It is not coming one day to another. It takes at national level 5 to 8 years before everybody agrees on the legislation. So what I'm trying to say is that on one hand, the European Commission need to invest in the nursing workforce through the European recovery and resilience plans, so that there is breathing space for the professional organizations, for the regulators, for the educational centers to bring this all together in a very, very difficult time. We are coming out of COVID-19 with a huge shortage of nurses and nurses massively leaving the profession. But what I'm trying to say is that the next generation, the recovery funds, is the money you need and allocate it to the right people and institutions to develop this new identity through new legislation. Because EFN tries to influence the Commission and the European Parliament. It's not on recommendations like WHO. If you come out of WHO with recommendations like in Israel, it doesn't oblige governments to do something. But when the European Commission writes EU legislation and you as a government are not implementing it, they can bring you to the European Court of Justice. And that is much stronger signal. So I hope that the European Commission helps with the guidance of EFN, of ICN, and other organizations to develop legislatively this identity. Because otherwise we can keep on talking and talking and talking, but if it's not grounded in law, nobody is obliged to do it. That is a little bit, I hope, is an answer to your question.
Yes, very, very difficult answer to to act in reality now, because it's a really, really big challenge. But I think that networking among all of us can be a real help to go on and to go for this big goal for the profession. So thank you for your advice. Thank you to all speakers for giving their contribution and precious contribution to this webinar. I hope everyone enjoyed the session. So thank you everybody for being here, and have a nice evening to everyone. Bye.
Bye-bye.
Bye.
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 Bye.